Okay, self-assessment about this chapter, the patient with neurodevelopmental problems. Question number 1. This is multiple choice question. A 7-year-old boy keeps getting up at school and walking to the front of the classroom. His mother is worried he has attention deficit hyperactivity disorder. He is not restless at home and sits calmly during the interview. What is the most appropriate initial step in management? Check thyroid function, collateral history from teacher, ensure he has an up-to-date eye test, genetic testing to exclude ADHD, refer to ADHD assessment. So, I think... this is the answer, because what's the answer is C. Ensure he has an up-to-date eye test. Why is that? This boy may not be able to see the blackboard, for example. So, and some children can be embarrassed to admit this. So that's why the patient is maybe that may be the cause. And as we said before, you should exclude any sensory impairment before considering ADHD. Anyways, question number 2. A 1-year-old girl has stopped crawling. She used to cry a lot, but is now calm and placid. She had developed a social smile, but has not done this for a few weeks. She also makes less eye contact than she used to. What is the most likely diagnosis? This is sad. We are talking about Rett syndrome. Okay, so she initially developed normally, then regressed. So that is Rett syndrome. Okay. A 23-year-old man reports he is very anxious in social situations. He recently lost his job because he talked too much in the office. Now he is worried about talking to others at all. He says he does not get the rules, and he thought his workmates were enjoying what he was telling them about the history of photocopiers. What is the most likely diagnosis? Anancastic personality disorder, autism spectrum disorder, depressive episode, generalized anxiety disorder, or social phobia. I think we are talking about does not get the rules, talking too much about something that he is concerned with. So here we are talking about autism spectrum disorder. Of course, mild case here, but this is suggested by his poor understanding of social cues and the hint that he has an unusual intense interest in something. But of course, to make this diagnosis definite, a much fuller history would be required, of course. Social phobia is unlikely, as the problem is his poor social understanding, not him feeling that others are critical of him. Even though social anxiety is also common in patients with ASD, but here we are not talking about that. Anancastic personality disorder is unlikely also, as this does not impair the ability to interact socially, so it has nothing to do with that. And the depressive episode maybe a result of the problem, but it's not here. It's not the problem here, and of course it's not generalized anxiety disorder. So that's it. Okay, for the extended questions. Functional estimate of IQ in intellectual disability, more than 100, above the average intelligence. 86 to 100, this is below average intelligence. 71 to 85, this is borderline intellectual disability. 50 to 69, this is mild intellectual disability. 35 to 49, this is moderate intellectual disability. 20 to 35, this is or 30 to 34, this is severe intellectual disability. And the less than 20, this is profound. So for each of the scenarios below, select one most appropriate estimate of IQ and level of disability from the list above. Okay, less than 20, 20, 35, 35 to okay, 50, 50 to 70. Okay, where are the cases? Case number 1. A 24-year-old woman lives alone and works in a bakery. She cannot serve customers as she finds it very difficult to use the cash register or give the correct change. She needed extra help at school with reading and writing and did not achieve any qualifications. So she lives by her own, but she has difficulties. So we are talking about mild intellectual disability, and the estimate would be the IQ between 50 and 69, because individuals in this group represent the majority of the intellectual disability cases, but they can depend on themselves, and that's good. Another case, a 19-year-old man lives alone, does not see his family, and is unemployed. He has no support at home and spends much of his time writing programs on his computer and reading about the mathematics of quantum mechanics. He has always found social interactions to be difficult and strongly dislikes socializing with others. There were no problems with language development. So I suggest that this patient has good IQ. Actually, this man may have above average intelligence, actually, because of his interests. We are talking about quantum mechanics and mathematics. So it would be more than 100 of IQ. And the difficulties that he has, maybe because of some kind of, I would say, maybe because of schizoid personality disorder or some kind of autism spectrum. Okay. Question number 3. A 14-year-old boy is wheelchair bound and incontinent. He lives with his mother, who is his main carer. He is unable to undertake any activities of daily living, and his mother has to feed him. We are talking about profound, of course, intellectual disability less than 20. Another case, a 35-year-old woman lives in sheltered accommodation and requires support to cook meals, to keep her flat tidy, and to do laundry. She has a job at a local toy factory where she works on a production line and is closely supervised by a trained support worker. So the patient here has severe, again, she lives she do things with support and with supervision. So we are talking about, moderate intellectual disability from 35 to 50 or to 49, because she is able to live on her own with support somehow. Okay. Another case, a 22-year-old man lives with his family, who are his main carers. He requires some assistance getting dressed and tending to his personal hygiene. However, he can do this by himself on good days. He can feed himself and spends his days watching children's television programs and playing with Legos. So this is severe intellectual disability. Okay, he needs to be taken care of and do things under supervision, even simple tasks. So this is severe. Okay. Differential diagnosis in adult presenting with attention deficit hyperactivity disorder assessment. We have ADHD, bipolar affective disorder, depressive episode, dissocial personality disorder, emotionally unstable personality disorder, generalized anxiety disorder, intellectual disability, no mental disorder, traumatic brain injury, and substance abuse harmful. Okay, so select the most likely diagnosis for the situations below. The first case here, a 24-year-old woman reports her thoughts are racing and she is unable to sit still for more than few minutes. She has felt this way for the past week. She denies any substance abuse. She had a similar milder episode a few months ago. Okay. Racing thoughts, restless, multiple episodes without substance use. So we're talking about bipolar disorder, maybe bipolar 2. So these symptoms would manifest mania or actually hypomania. Okay, that's it. A second case, a 31-year-old man has had 5 jobs in the last 2 years. He keeps getting fired for making careless mistakes. He says he has always been this way. He is fidgety in the interview. He causes cocaine most weekends. He uses cocaine most weekends. So here we are talking about substance abuse, of course. Okay. A 32-year-old man cannot concentrate and feels extremely irritable. He is pacing his house and having thoughts of suicide. These feelings began after his wife left him a month ago. This may be a depressive episode with irritability or with anxious distress. It can mimic, it can cause these symptoms. A 26-year-old man has just been released from prison for assaulting a police officer while on night out. He was expelled from school for bad behavior, talking too much, disturbing other pupils, not doing homework. He regrets the assault and would like to go to college, but keeps losing the application form. So here we're talking about ADHD, of course, because even the assault here was some kind of impulse. A 39-year-old man struggles to concentrate on tasks such as paying his bills. He has started gambling. At interview, his speech is hard to interrupt and his thoughts form tangential. He has had to give up his job as an accountant following involvement in a road traffic accident. Again, he has had to give up his job as an accountant following involvement in a road traffic accident. Okay. We need to check for that road traffic accident because it's not a coincidence to mention that in this question. So I think the answer that they want is traumatic brain injury. But we should know more about the RTA and the timing of the symptoms in relation to the accident. So that's it. We are done here.